The early detection of glaucoma is essential to prevent vision loss as well as blindness. This is one of the main messages on World Glaucoma Week starting from tomorrow. In Sub-Saharan Africa, it is estimated that 4.16% of the population aged 40 years and older are affected by this condition, with a higher incidence among the black population compared to the Caucasian population. For more on this, I am joined by Dr. Marissa Willemse, who is the president of the SA Glaucoma Society. Dr. Willemse, thanks for joining us this afternoon. Firstly, can you elaborate on the importance of World Glaucoma Week and also its significance in preventing blindness, especially considering the alarming statistics regarding glaucoma's impact on vision loss in Africa?
Yes, Nhlanhla, thank you very much for the opportunity. I think the main thing is that we misunderstand glaucoma. It's a silent theft of sight, and we do not understand that patients don't understand that there's no real symptoms. And most of the patients, almost 50%, will already be blind by the time they see an eye doctor. So World Glaucoma Week are there to make patients, and especially our black population, aware of the danger of glaucoma, and that there are free screenings available all over South Africa and even in Sub-Saharan Africa. Every eye unit has free screening, free pressure testing, and that's so important so the population can understand that they can get help.
Speaking about getting help, let's speak about the lack of awareness and late diagnosis. It does pose a major challenge in combating glaucoma. What initiatives or strategies does the SA Glaucoma Society then employ to address these issues, particularly in reaching underserved communities where the burden of glaucoma may be higher?
Yeah, we really have a big backlog of patients in our government setup, and that is why as private doctors there's also initiatives, and they are driven by our glaucoma societies to try and get the patients to the doors so that they can at least get some screening and they can get to treatment. Because glaucoma treatment, we start off with eye drops. So it is not as invasive and as bad as everybody think it is. But delaying it can cause total blindness. Patients usually only get aware when they lose their driver's license because their peripheral vision, the side vision, are lost. And that is when patients get aware of it.
So one of the key risk factors for developing glaucoma is age, with individuals over 40 years being particularly vulnerable, as mentioned in my intro. How can we then encourage regular eye examinations among this demographic? And what role do primary healthcare providers then play in early detection and referral?
Yeah, primary healthcare providers is very important. In our eye clinics, in our secondary hospitals, the clinics do have some screening. Optometrists also do screening all over South Africa. And that is a entry level where patients can test their eyes, but also test for intraocular pressure. Doctors are available. Mostly in government setup, it is difficult to reach a tertiary hospital. But with a family history, that's also important to mention, that the family history of patients are then taken more seriously, and we really want to look at the children and the relatives of that family in specific.
So glaucoma is often referred or termed as the silent thief of sight, due to its asymptomatic nature in the early stages. How can individuals then become more proactive, if you will, in monitoring their eye health, especially if they belong to a higher risk group?
Well, testing and regular screening is very important. If you're part of a higher risk group, you definitely need to be screened. Over the age of 40, definitely. Genetic factors, also when you have medical conditions like diabetes, go and knock on the door of doctors or optometrists and eye specialists, and they can have a look at your eye, screen the eye, not just for testing for pressures, but also looking at the nerve, because glaucoma can cause nerve damage, and we want to detect it earlier than when you have already lost some sight.
So treatment options for glaucoma include medication, laser therapy, and even surgical procedures. Can you provide some insight into the effectiveness of these treatments and also the importance of adherence to treatment plans in really managing this condition?
Yes, it's very important. With the eye drops, most of the patients, about 70% of patients, can be managed just with a one drop only. Some patients need more drops, and eventually we also do laser therapy, which we call SLT. That laser can also decrease the burden of eye drops. If laser and eye drops does not work or does not prevent a patient from progressing or losing visual fields, or even just some optic nerve damage is seen, then we'll rather go over to surgery. Now, what is very important is to know that once we diagnose glaucoma, we have to individualize each patient's treatment plan because of the stage of glaucoma, your risk, a family risk or risk of the other eye already perhaps being blind, and that will determine how early we will reach for surgery or how low our target pressure for glaucoma and the eye drops need to be.
As we continue speaking about the treatment, access to eye care services, including screening like we've mentioned, diagnosis and treatment, it is quite crucial for effective glaucoma management. But what steps are being taken in South Africa to really improve the access to these services, particularly in rural and underserved areas?
Yes. That is where we have mobile clinics that come in at times. There are specific outreaches that are launched in different areas with the government as well as the private sector, reaching smaller areas and making them aware of the screening of glaucoma.
There's also a mention of the devastating social, the personal, and also the economic impact of vision loss due to glaucoma. How can support networks and even resources be made more accessible to individuals, especially living with glaucoma, and their families as well, to really navigate treatment and care effectively?
I think our biggest problem is definitely patients that have glaucoma and already are debilitated need a care. And that carer are sometimes, especially in our rural areas, a child that then does not finish school because he needs to look after his parent, who then has to be able to not really get an income. At this stage, it is very important that we look at the infrastructure, not just at social grants, but also looking at the clinics having enough eye drops, because that has been a problem in the last couple of months where the government setups did not have enough medication, and we're trying to motivate funders to help with that so patients won't be without any treatment. That is very important. The socioeconomic effect in the long run is extremely important to the patients and their families.
Thank you so much for joining us, Dr. Marissa Willemse, and providing valuable insights into the critical importance of World Glaucoma Week in really raising awareness about glaucoma and preventing blindness.